Good afternoon, everyone. To all the participants attending the session, I am Dr. Sonali Thakur, Assistant Professor, School of Pharmacy, is here to share information to all the antibiotics. So, start the antibiotics. First of all, what is antibiotics? Antibiotics is the form of antibiosis, meaning against life, substance that derived for a microorganism or proceed synthetically like sulfonamide and quinolones to kill or suppress the growth of another microorganism. Classification of antibiotics. These are three classification of antibiotics. First of all, on the basis of mechanism of action. Second, on the basis of spectrum of activity. Third, on the basis of mode of action. Let us discuss about first of all mechanism action of antimicrobial agent. First, inhibition of a cell wall synthesis. Cell wall synthesis like penicillin, cephalosporin, bactostatin, and vancomycin. Inhibition of a function of cellular membrane like polymyxin. Inhibition of a protein synthesis, cephalosporin, macrolides, and clindamycin, tetracycline, and aminoglycosides. Fourth, inhibition of nucleic acid synthesis like quinolones, rifampicin, inhibition of folic acid synthesis, sulfonamide, and trimethoprim on the basis of mechanism action. First of all, there are three mechanism action. First of all, cell wall synthesis. Second, nucleic acid synthesis. Or third, protein synthesis. Cell wall synthesis like bacterial lactam, penicillin, cephalosporin, carbapin, monobactam, vancomycin bacteria, cell wall membrane, polymyxin. Second, folate synthesis, sulfonamide, trimethoprim, 30S subbutane unit, tetracycline aminoglycosides, 5-SOS substance like microlides, clindamycin, linezolid, chlorofluroquine, streptogramine, nucleic synthesis like DNA graces, quinonol, rennin polymers, rifampicin. Antimicrobial spectrum. These are two spectrum. First of all, narrow spectrum and broad spectrum. Antimicrobial spectrum. The scope that a drug kill or suppressive the growth of microorganism. Narrow spectrum. The drug that only act on a one kind or a one strain of a bacteria like isonazide. Broad spectrum are the drug that have a widely antimicrobial scope, tetracycline and cephalosporin. Next, on the basis of spectrum of activities, these are four activities. First है microbacterium, gram negative bacterium, gram positive bacterium, clindamycin and rickets. First of all, microbacterium. Microbacterium further classify into tobobrycin, streptomycin, isonazide, and polyaxin. Gram negative bacteria and gram positive bacteria, penicillin, cephalomides, cephalosporin. Then gram negative, gram positive, clindamycin, and rickets is further divided into tetracycline on the basis of mode of action. There are two type of mode of action. First of all, bacteriostatic antibiotics and bactericidal antibiotics. First of all, antibacterial antibiotics. First, tetracycline, cephalosporin, erythromycin, lamocicin. Bactericidal antibiotic. Cephalosporin, penicillin, erythromycin, aminoglycosides, and cotrimoxazole. Misuse of antibiotics. Antibiotics misuse, sometimes called antibiotics abuse or antibiotic overuse. The misuse or overuse of antibiotics may proceed serious effect on a health. It is contributing factor to the create of multiple drug resistance bacterial inflammation called superbugs. Antibiotic resistance and cross resistance. First of all, discuss about antibiotic resistance. Antibiotic resistance is the phenomena that susceptibility to pathogens, microorganism to antibiotic become lower or even lost after the microorganism contact with antibiotic many times. When the bacteria show a resistance to one antibiotic, they are also resistant to some another antibiotics. This phenomena is called a cross antibiotic resistance. Mechanism action of antibiotic resistance. These are five type of mechanism action. First, alternation of a target site on of the antibiotics. One of the most probability antibiotics resistance worldwide, methicillin resistance among the streptococcus aureus, enzyme inactivities of antibiotics, beta-lactam antibiotics, penicillin, cephalosporin can be inactivated by beta-lactamase. Mechanism these are activity transport of the antibiotics out of the bacterial cell, active transport of antibiotics out of bacterial cells, influx pump or removal of some antibiotics like for example tetracycline and microlides and quinonol. Fourth, detection of permeability of the bacterial cell wall to the antibiotics. Alternation in the protein that form channelize in the cell membrane. For example, resistance of a pseudomonas aerogens to a variety of a penicillin and cephalosporin. Mechanism action of antibiotic resistance. These are four types of mechanism action: decrease permeability, influx pump, alternate target, enzymomatis. First of all, beta lactam aminoglycosides, influx pump, tetracycline, quinonol, microlides. Alternate target, beta lactam, quinonol, aminoglycosides, vancomycins, microlides, TMP, SMX, enzymatics, inactivations. Journal principles of antimicrobial therapy. These are different type of therapy. We will discuss one by one. Identification of the infective organism should be proceed antimicrobial therapy when possible. Second, day pathogenesis microorganism susceptibility to antimicrobial agent should be determined if a suitable test exists. Factor that influx the choice of antimicrobial agent on its doses for a patient, including the age, renal and hepatic function, pregnancy status, and the site of infection, etc. Selection of antimicrobial agent. These are the different therapy to under the selection of my antimicrobial agent. First of all, amphoteric therapy. Amphoteric therapy priors to a identification of organism critically ill patient, organism susceptibility to the antibiotics, patient factor like immune system, renal system, hepatic function, effect of a site of an infection on the therapy like blood brain barriers, safety of the agent and cost therapy. Ideal antimicrobial agent have a highly selective toxicity to the pathogen microorganism is in a host body, have no or less toxicity to the host, lower properties of a development of a resistance, not include hypersensitivity reactions in the host, have a rapid and extensive tissue distribution, be free or interaction with another drug, be relate inexperienced. Complications of antibiotic therapy. Resistance due to impaired use of antibiotic, hepatitis like penicillin, direct toxicity, aminoglycosides is equal to autotoxicity. Superinflux, broad spectrum antimicrobial, cause a alternation of a normal flower often to a difficulty to treat. Antimicrobial combination. Result of combination therapy. These are three therapy. First of all, additive identified effect. First of all, the activity of a two drugs in combination is equal to a sum or a particular sum of their independent activity when studied spectral. Cyanogenetic effect. The activity of a two drug in a combination is a grade to the sum of their independent activity when study spectrum. Antagonist effect. The activity of a two drug in a combination is less to the sum or a particular sum of their identify active when a study in a spectrally in indications of a clinical use of a antimicrobial combination. First of all, prevention of the emergency of a resistance organism, polymicroinflux, intel therapy, decreased toxicity, and synergistic. First of all, prevention of a emergency of resistance organism. First of all, decrease resistance microbacterium tuberculosis with combination. Reduction of beta lactam including with combination of beta lactam against and aminoglycosides. Polymicroinflux. First of all, intern abdominal infection, pelvic infection, mixed anaerobic and aerobic organism. Initial therapy, neutro opening patient in a patient when the nature of a infection is not clear yet. Decrease toxicity. Decrease the toxic drug required for a treatment and thus reduce the dose related toxicity. Synergistic effect. Enhancing uptake of aminoglycosides when combined with beta lactam agonist. First of all, treatment of enterochlorus, endocritus, aminocycline, and gentamicin. Very dense Streptomyces, endocrines, penicillin, and gentamicin. Streptococcus, bacteriomyces, vancomycin, and gentamicin. Treatment of pseudomonas infection like beta-lactam against and aminoglycosides. Inhibition of sequence steps. Sulfonamide with trimethoprim treatment and prevent of a chronic urinary tract infection, thyroid fever, analgesic, cause or organize resistance of a ampicness, inhibition of a enzymatic activations. Disadvantage of the impaired use of antimicrobial combination. These are four combination: antagonism, increased cost, adverse effect, suppress infection, alternation of the normal flow, often to a difficulty to treat. Class of antibiotics. The main class of antibiotic are beta lactam, penicillin, cephalosporin, carbapin, monobactam, microlides and ketolides, aminoglycosides, fluoroquinol, tetracycline, amphocyclolise. One by one, we will discuss first of all penicillin. The penicillin are the oldest class of antibiotics. Penicillin have a common chemical structure which they are shared with a cephalosporin. Penicillin are generally bacteriolides, inhibition formation of the cell wall. Penicillin are used to treat a skin infection, dental infection, ear infection, and respiratory tract infection, urinary tract infection, and gonorrhoeas. Type of penicillin. These are three type of penicillin. First of all, the natural penicillin. Natural penicillins are found in a penicillin G, penicillin nice resistance penicillin, methicillin and oxacillin, aminopenicillin, ampicillin and aminocycline. Penicillin side effect: diarrhea, nausea, vomiting, and upset stomach. In a rare case of penicillin, can cause immediately and deletely allergical reaction, specifically skin rashes, fever, and anaphylactic shock. Penicillin are classed as a category of B during pregnancy. Cephalosporin are used to treat phenomena status, throat, stabs, infection, tonsillitis, bronchiolitis, otitis media, and various types of skin infection, granulitis, urinary tract infection. Cephalosporin antibiotics are also commonly used for a surgical prophylaxis. Cephalosporin can also used to treat a bone infection. The first generation of cephalosporin for these process generally excellent coverage against most gram-positive pathogens and variable to poor convey against a most gram-negative pathogens. The first generation including sphalodin, sphalolaxin, sphalodroxin. The second generation of cephalosporin, in addition to the gram-positive spectrum of a first generation cephalosporin, these against have a expanded gram-negative spectrum. Sphalostin or a sphalotine also have a good activity against bactericidal frangulus. The second generation including sphalochlorine, bacteriochlor, and sphaloxine, xanthan. The third generation of cephalosporin, they have much expanded gram negative activity. However, some one member of this group have a decreased activity against gram positive organism. They have the advantage of convey administration, but they are expensive. The third generation including sphalozidine, sphixim, sphaloperazone, sphalotoxin, sphalotrizone, sphalodrin. The fourth generation of cephalosporin, there are extended spectrum against with a similar activity against gram-positive organism as a first generation cephalosporin. They also have a generate resistance of a beta-lactams than the third generation cephalosporin. Many fourth generation cephalosporin can cross blood-brain barrier and are effective in a malignage. The fourth generation cephalosporin is Fixim. The fifth generation of cephalosporin used to treatment of MRSA, methylocline resistance, streptococcus aureus, penicillin resistance, streptococcus pneumoniae, pseudo analgesic and enterococcus. The fifth generation including cephalosporin and sphalobioprin. Cephalosporin side effects like diarrhea, nausea, mid-stomach upset. Appropriate 5 to 10% of patients with allergical hypersensitivity to the penicillin will also have a cross relative to a cephalosporin. Cephalosporin antibiotics are classed as a pregnancy category B. Advantage effect of a Adverse effect of a cephalosporin include headache, rash, GI upset, phlebitis, hypertension, seizures in the patient with a renal dysfunction. Microlides. Microlides are a bacteriostatic binding with a bacterium ribosome to inhibit a protein synthesis. Microlides antibiotics are used to treat a respiratory tract infection such as pharynx, sinusitis, and bronchiolitis, gastrointestinal tract, and skin infection. Macrolides antibiotics are erythromycin, clearomycin, azithromycin, and lexomycins. Macrolide side effects like nausea, vomiting, diarrhea, infrequent, they may be temporary auditory impotence. Oral erythrocytes may be highly irritation to the stomach and which give have a injection may be cause several periphery. Microlides antibiotics should be used with a calculation in the patient with liver dysfunction. Pregnancy category B azithromycin and erythromycin. Pregnancy category C clarithromycin. Keto acid ketolized. Ketolized is an antibiotic belong to a microlides group much broad spectrum than the another microlides. Ketolides are effective against microlides resistance bacteria due to their ability to bind at a two site at the bacteria ribosome as well have a structural modification to make some them poor substance of influx pump medication resistance. They only ketolides on the market at a moment of a thylomycin, which is sold under the brand name of Kitek. Limosides, example linosides and clindamycin. Linosides prevent bacterial replacement by a infection with a synthesis of a proteins. They are normally used to track streptolysis and streptococcus and have a provide useful in treating bacteriolides, pharyngitis, and some another anaerobics. They are used in the treatment of a toxic shock syndrome. Linoside antibiotics are one of the class of a antibiotic most associated with a pseudo membrane closed caused by a C. difficile. Aminoglycosides. Aminoglycosides are a bacterial and work by a spotting bacteria for making a protein. Aminoglycosides antibiotics are used to treat infection caused by a gram negative bacteria. Aminoglycosides may be used among with a penicillin or cephalosporin to give a two prolonged attached on the bacteria. Since aminoglycosides are break down easily in the stomach, they can't be give a mouth, and must be injected. Generally, aminoglycosides are given for a short time period. Aminoglycoside group including amikacin, gentamicin, neomycin, streptomycin, trobomycin, fluoroquinolone. They are a synthesis of an antibiotic not derived for a bacteria. Fluoroquinolone are a broad spectrum bacterial side drug that are chemically unrelated to the penicillin or the cephalosporin. Fluoroquinolone inhibition bacteria and influencing with their ability to make DNA. This effect of a bacteriolites because of their excellent absorption of a fluoroquinolone can be administered not only interviews but orally as well as fluoroquinolone are used to treat most common urinary tract infection, infection and respiratory infection. Fluoroquinolone group include ciprofloxacin, levofloxacin, norofloxacin, ofloxacin, moxofloxacin. Fluoroquinolone side effects like nausea, vomiting, diarrhea, abdominal pain, irritability, damage of central neuron system, pregnancy. Fluoroquinolone are also called as a pregnancy category C drug. Trimethoprim and sulfonamethoside or chlorotextrozole, an antibiotic used in the treatment of a variety of a bacterial, fungal, and a protozoal infection. Clotrimazole is a generally considered bacteriolide, although its components are including bacteriostatic. Its action are a antiflollate in a naturally inhibition both denotes folate and biosynthesis and metabolism. Clotrimazole side effects nausea, vomiting, an allergical reaction, and infection with cholesterol difficulty, and type of diarrhea. Cotrizoles is a class as a pregnancy category C. Someone start should be used to during breastfeeding will be otherwise say it is okay. Tetracycline, these are three types broad spectrum tetracycline. Broad spectrum bactericides against and work by a inhibition of a bacterial protein synthesis. Tetracycline may be effective against a wide variety of a microorganism including rickets and amebolic parasites. Tetracycline are used to treatment of infection of the respiratory tract, sinus, middle ears, urinary tract, skin irritability. Tetracycline also used to treat gonorrhea, rocking, mucositis, spotting fever, linomyid disease, thiopeas. They are most common currently used in a treatment of a modify several acne and rosacea. Tetracycline antibiotics are tetracycline, doxycycline, minocycline, oxotetracycline. Tetracycline side effects cramps and burning of the stomach, diarrhea, sore mouth of or tongue, skin photosynthesis, allergical reaction. Tetracycline antibiotics should not be used in a children under the age 8 and specifically during periods of the tooth development. Tetracycline are a class as a pregnancy category D used during pregnancy may be cause a alternation in a bone development. Fipicol. It is a bactericide. It is considered by a proteolysis broad spectrum antibiotic along the tetracycline, and as it is both cheap and easy to manufacture. It is frequently an antibiotic of a choice in the development of a world effective against a wide variety of a gram positive and gram negative bacteria, including most anaerobic organisms. Chlorophenol side effect. The most serious adverse effect associated with a chlorophenol treatment is a bone marrow toxicity used to interviews chlorofluococune has also been associated with gray baby syndrome. Another less serious reaction including fever, rash, headache, confusion. Glycopeptides, example vancomycin, trichomycin. These are antibiotics are effective a peripheral against gram-positive coccus. This class of a drug inhibition of a synthesis of the cell wall in a susceptibility microorganism by inhibition and dilute glycoside synthesis. Vancomycin is used in an infection with methicillin resistance of a Streptococcus aureus. MRSA is subst- substract. Vancomycin के side effects. Vancomycin usually give a intravillus as a infusion can cause tissue necrosis and phenobitis at injection sites. Redman syndrome and idocyanate reaction of a blood dose cause a histamine released. Neuropathotoxicity, including renal failure and internally neurotherapy. The blood disorder, including neuropenum and dysphanum, which is replaceable one of therapy, has stopped. Risk of a autonomic patient with a renal impairment. Streptogram, effect of a statement, vancomycin resistance, Streptococcus aureus, and vancomycin resistance, enterocytes, two of the most rapidly growing straining of a multiple drug resistance bacteria, member including quinoprine, dafoprine, peristomycin, vancomycin. Adverse effect including relate to administration by, peripheral vein, infection, pain, edema, infusion, site of reaction, thrombolytic, non-vancomycin adverse effect, nausea, vomiting, diarrhea, rash, headache, pain, ill different in a focal or general discomfort, congestive hyperbiliria, erythrolysis, asthma, oxanolitis. Linosides inhibit a ribosomal protein synthesis by a inhibition formation of a inhibition of complex. It is used to treatment of a serious infection caused by a gram-positive bacteria that are resistant to a several another antibiotic. Lunogide is an active agent most of gram-positive bacteria that cause disease including Streptococcus and vancomycin resistance. Enterococcus when a methicillin resistance and Streptococcus aureus. The main identification of leukocytes are infection of the skin and soft tissue and phenomena, particular hospitalized acquired to a phenomena. Common advantage effect of a short-term use, including headache, diarrhea, nausea. Long-term use have been associated bone marrow suppress and lower platelet count particularly when used more than 2 weeks. If used for a long period, still it may be cause some time irreversibility, including a peripheral neuropathy and optimum neuro damage and lactam acidosis and ansomycin. a family of a secondary metabolic that show a antimicrobial activity against many gram-positive and some gram-negative bacteria, including a various component among which streptomycin and rifampicin. Rifampicillin are a suitable class and aminocycline with a highly potential against a microbacterium. This result is their worldwide used to a treatment of tuberculosis, leprosis, and AIDS-related microbacterium infection. The antibiotic activity reflux related to inhibition of bacteria DNA depend upon RNA synthesis. This is due to high effective rifampicin for a protect in a RNA polymers. Advantage effect including hepatotoxic in a liver failure and several cases, respiratory breathless. Consequently, frequently proteins rashes reduce and watering of eyes, abdominal nausea, vomiting, abdominal cramp with or without diarrhea, flu-like symptom with a chills, fever, headache, and malaria has a good preparation to a brain, and this may be direct explain some melanitis and diaphronic in a monitoring to user. Rifampicin is a synthetic antibiotic based on a rifampicin. Has a poor oral bioavailability, meaning that very little of the drug will absorption into a bloodstream when it is take oral rifampicin used to the treatment of traveling diarrhea hepatitis for which received orphan drug status, use an USA Food and Drug Administration in 1998, rifampicin infected with a transcription by binding of a beta substance of bacterial RNA polymers. On an orphan drug, it is pharmaceutical agent that have been developed specifically to treat rare medical condition. Metronidazole, a nitroglycosides antibiotic medication to use particular for anaerobic bacteria and protozoan. It is antimicrobial agent anaerobic organism as a anabolic and anthroponazole. It is inhibit in nucleic acid synthesis by destroyed by a DNA of a microbialized cell. This function only occurs when a mitronidazole is a particular reduced, and because this is reduction usually happened only a anaerobic cell, it has related to a little effect upon human cell or anaerobic bacteria. Metronidazole is a primary used to treat bacteria, vengocide, pyloric infectory disease, along with another antibiotic like cefalozine, pseudomembrane, cyclosides, aspirated phenomena, roseous, fungals, intra-abdominal infection, lungs abuse, anabolic tetramycin, and infection caused by a suspectable anaerobic organism such as bacteriocides. It is also often to use anterior halobacterium pylorus along with another drug prevent infection in a people recovering for a surgery. Disadvantage declare urine, headache, metalysis taste, nausea. Metronidazole is classed of pregnancy category B. And then thank you.